It is your right as a middle-aged woman to be able to have access to therapies that will allow you to have a high quality of life.
You are tuned into the Dr. Tina Show with Dr. Tina Moore. For more, visit drtyna.com. On this episode of the Dr. Tina Show, I am sitting down with my friend, Cynthia Thurlow. You may know her from times past as an intermittent fasting expert. She is also a nurse practitioner, a perimenopause and menopause specialist, a women's health advocate, a beautiful and intelligent woman, and we always have the greatest discussion. She had me on her podcast recently, and I had such an enjoyable conversation with her that I brought her onto mine. And while we originally wanted to talk about intermittent fasting, and we definitely got there, we had a phenomenal conversation about bioidentical hormone replacement and all things perimenopause and menopause, and you're going to want to listen to this. We are very much on the same page, and she brings a lot of knowledge to the conversation. So without further ado, let's jump in. Cynthia Thurlow, thank you so much for being on the Dr. Tina Show. I am so delighted to have you here finally, and thank you for making the time because I know you're in a big book crunch. I'm really excited about what you're going to be putting out in the world soon. So we are going to be I'm going to be asking you the questions my audience has been asking me to address, which is really this conversation around menopause, intermittent fasting, and hormones. And who better to bring on about this than you? So welcome.
Thank you so much. I've been really looking forward to this discussion myself.
Yes, we had a fun time on your podcast. You were so gracious to have me on there, and your audience was a great response from that. So I think our audiences overlap quite a bit, and this will be very, very informative for them and bring them a lot of value. So that's how I know you. I know you from back when, a couple of years ago, I remember finding you talking about intermittent fasting, and I was sharing with you off camera that one of the things that I have failed to address is this topic because I personally I really did have some pretty severe eating disorders as a young person. And then many, many decades ago, I met my mentor and he taught me really just to avoid eating for like skip breakfast, basically, don't eat a late dinner and then eat an early lunch. That was our version of intermittent fasting. And so I never thought anything of it. And I did get accused of eating disorders over the years because I skipped breakfast. And I was like, I don't know, I'm good. Like, stop eating when the sun goes down and then eat right. Like, I usually take an early lunch anyway. And that's always served me well. And my body composition's always stayed in check. And then this topic of intermittent fasting came up years ago. And it's really drawn a lot of attention. And I think that there's many interpretations and there's many versions. And I think it's different for men versus women. And so anyway, I failed to address it because I don't really like talking about food because people get so pissy. So we're going to let you do
it. Well, I think that, I came to intermittent fasting. It's always good to give context. So I spent 16 years in clinical cardiology as an NP, and people always wonder, like, how in the world did you make that transition from cardiology, ER medicine into women's health? And I think it really comes down to the power of the N of one. So I was that typical perimenopausal woman who got stuck. I had never been someone who struggled to lose weight after pregnancies. And all of a sudden I was like, what is happening to my body? I have these horrific crime scene periods. I'm gaining weight. My hair is falling out. I'm losing the outer third of my eyebrow. I can't sleep. I was really thrown into perimenopause. And the backstory to that is that I had a very stressful job. As you can imagine, cardiology, you're working with like some of the sickest patients in the hospital. My husband traveled quite a bit and I had 2 young kids. And so I was doing all the wrong things. I wasn't sleeping enough, not purposefully. My activity was way too intense. I was too low carb because I had just kind of navigated into this paleo world, which was great because it cured my autoimmune condition that I had. And I just didn't know that that was like the perfect storm to get me into a situation where I was weight loss resistant. And I kind of stumbled upon Jason Fung's work. And I always like to give Jason credit that, his work is what gave me the confidence to feel like, okay, there's solid research. He's using it with his own. He's a nephrologist, using it with his patients who have kidney disease. And so initially I started intermittent fasting just for myself. And I felt so much better within 2 weeks because I was one of those people that brought snacks and mini meals to work, to the gym. I mean, I would have a protein shake going to the gym at 5 o'clock in the morning and one going to the hospital. And I'd have all these other mini meals and food prep. I mean, I did food prep up the wazoo. But the point of why it's important to kind of share my journey is that I didn't lose weight initially, but I felt so much more mentally clear. I felt like I could go hours and hours and working in a hospital. This is sometimes important because sometimes you're lucky if you can empty your bladder, let alone eat real food.
Mm-hmm.
And so suddenly I had more energy, more mental clarity. And I was like, I wonder if this is something I can talk to my patients about. And so the ones that were receptive, because let's be clear, we've conditioned our patients to eat snacks and mini meals and eat all day long to stoke their metabolism. And for a lot of people, they like their breakfast. They like their mid-morning snack. They like their lunch. They like their mid-afternoon snack. They want to have their dinner and then have, cake and ice cream at night. And that has become like their ritual. But for those that were interested in changing how frequently they were eating and having a longer period of digestive rest, if you will, they started seeing some pretty incredible things. And as you can imagine, in the area of medicine I worked in, we had patients on 20, 30 plus medications. When people started getting off of medications, less blood pressure medicine, less diabetes drugs, this is before the GLP-1 revolution, changing their lipid drugs, people were really impressed. And so I got to a point with intermittent fasting where I felt like my focus in my life was really changing, that I really wanted to serve women. So I took this kind of leap of faith. And for the past almost 10 years now, really speaking to the value of eating less frequently. Now, that could look very different for each one of us. And you're absolutely correct that women and men need to fast differently. Women are really bound up until menopause by their menstrual cycles and when it's appropriate to fast and when not. I think that for a lot of individuals, it has been very freeing to be able to be in a position where they don't feel like their whole focus of their day is when's my next meal, because they had such tremendous blood sugar dysregulation and, really looking at the poor metabolic health over the past 25 years, being privy to an environment where I've been able to watch this unfortunate evolution of less people that are maintaining insulin sensitivity, that are still metabolically healthy, navigating and traversing their 20s, 30s, 40s, 50s, and beyond, and feeling like for a lot of people, it's allowing them to have the flexibility to fast when they choose to, and to have the ability to regulate their blood sugar, make better food choices, feel like they have something that's within their control. Because let's be clear, as a woman navigating perimenopause and menopause, it is a bit of a shit show.
Yeah.
And I think a lot of our well-meaning providers are not preparing us for what is to come, because I certainly wasn't prepared. I don't recall there was one sentence about perimenopause. There was probably 2 sentences about menopause. It was literally like that kind of a cursory depiction. And I actually went back. I actually still have some of my medical texts. Went back and thought to myself, am I kidding? No, it was real. It was like, this is the menstrual cycle. This is what happens in pregnancy. This is what happens in the postpartum period. And oh, by the way, when you go 12 months out of menstrual cycle, you're in menopause and, you drop off a cliff. And so I think for a lot of women, certainly our generation, I feel like we are so much more aware, and we are doing everything we can to make women aware of this kind of navigating this hormonal chaos in perimenopause. And then the chaos improves in menopause. But I do think intermittent fasting can be a strategy that women can utilize, whether it's short-term, long-term with some caveats. I think all of the above can be very helpful and beneficial if people are being conscientious about nourishing their bodies, because that is a message that I think a lot of people in the intermittent fasting space are not speaking to. I think we as women are innately hard on ourselves. We self-flagellate. We beat ourselves up. I think that women in perimenopause and menopause that have never dealt with a weight problem or have had a weight problem before and it just gets exacerbated, or they're dealing with this as a new thing, they just start being even harder on themselves. And we hear this. We hear this in our DMs. We hear it in emails. We hear it in programs. Women are just beating themselves up all the time. And they think that if I eat less and I exercise more and I undernourish my body, that's going to make them healthy. They're still so focused on being skinny and not being strong. And I'm here to tell you, if you are focused on the wrong thing, you are going to suffer. And I don't just mean suffering emotionally. I think you are going to suffer physically. And I speak from personal experience. losing my dad last year, this is someone who unknowingly put himself in a position where he dealt with significant sarcopenia. These are topics I know that you talk about. So significant sarcopenia, significant frailty, led to falls, led to head bleeds, led to his death.
Oh.
And so I try to make sure that when I'm having this conversation, I encourage women to be thinking about, if you are undernourishing your body constantly and for years and years and years, you don't want to be that person. And I think that is a cautionary tale. It doesn't happen to everyone, but I certainly have been privy to watching that evolution in thousands and thousands of patients who don't realize that, what they're doing in their 40s and 50s really do have a long-term net benefit or impact on their health.
Amen to every word you just said. I think about this all the time. As a chiropractor, an interesting slant to bring to this. There's like the chiropractor in me has some thoughts and the naturopath in me has some thoughts. One is, in the chiropractic world, we were studying conditions from the inside. So we were looking at, it was like extensive bone pathology courses, looking at x-rays and imaging of different conditions. So you could see the inside of the body and what these conditions were doing to the bones and ligaments and tendons. And in so many of these conditions, they would be exacerbated or come on right at middle age. It was middle-aged women, right? Like you have to learn the age and the gender cohort of when these conditions are most common. And it was like middle-aged women. And not a lick of talk about the waning estrogen that was clearly contributing to the instigation of these conditions, really, rearing their head. And I'm like, I'd be raising my hand, like, does diet or hormones have anything to do with this? And they're like, oh, no. And then the naturopathic side of me, but back to the chiropractor, we learned very early on that breaking your hip is the kiss of death. I mean, period. That's how it was taught. There's no sugarcoating this. You break your hip, your chances of dying are extremely high at the time, within the next few days to weeks. And these poor women end up in the hospital with pneumonia. So they drowned in their lungs. And in many cases, they're too frail or too fractured to even reset the hip joint. So they just die with their hip out of socket from pneumonia. Which is
incredibly painful, not to mention the fact you take a menopausal female that has been off of any type of, if they got any hormone replacement therapy, you end up uroseptic. So they get an infection, a urinary tract infection develops into a blood infection. And most of the patients I saw in the ICU that were women were uroseptic, and it changes. They get a mental status change. It can happen to men too, but not nearly as often. And you're right. If you break your hip, your morbidity and mortality goes up exponentially. And
for a decade.
Yes.
Like if you clear it, if you get out of the hospital, you got another 10 years at a very high risk of dying.
Yep.
And it changed. I've never seen somebody break a hip and come out of it and be back to who they were. Like they even if they live many years longer, I've had several patients, make it through that, and they just are never the same again. Their cognition's always off, their affect's off, their mood's off. Their mobility is off. And so it's just, anyway, so then the naturopathic side of me was taught to rest your gut. In all cases, rest your gut, specifically if you're not feeling well. Rest your gut, let your gut heal, give it a break. So, periods of fasting where we would use broth fasts or vegetable broth fasts or water fasts to regenerate people. And my mentor taught me he was a naturopathic physician and an acupuncturist. So then there's like the cold foods and hot foods, that's in there too at the right times. And then he taught me to avoid carbohydrates at lunch. Like when you need energy, don't go carb load yourself because you'll be sleeping in an hour because of your insulin response. And so I learned all these little things and kind of put it together. That's why I said I just always sort of ate a certain way. And it didn't have a name or a term. Like it wasn't intermittent fasting. It was just like, this is what you do for health kind of thing.
Yeah.
And then I had another chiropractor that I was at a lecture, and he said, America is a food trough and you're feeding yourself all day. And like, don't do that. Like my mentor taught me, you should be able to go 5, 6, 7 hours without a meltdown. And I was that hypoglycemic, hangry mess. But, supporting the adrenal glands, I think, is really, really helpful in these situations because it allows you to have some regulation over your blood sugar more readily. But man, like That's a superpower. I watch my husband melt down at hour 4 and I'm just like, I'm good. I've trained myself. I think you have to train it. Like you have to train yourself, and
it's like a muscle.
Yeah. And like balance out, your blood sugars will start to balance out as you, put yourself into these mini challenges of timing with food, and then it gets easier, and then your health improves and it gets easier. But when he starts to melt down, I'm just like, I'm good. I got another 6 hours in me.
Well, and I think it's important for people to know that our bodies are designed to be able to go longer periods without eating. And I'm not suggesting, we're not talking about starvation. We're just saying that we would not be here as a species from an evolutionary perspective if we could not do that, because we had to be able to go long periods of time. Feast and famine was a real thing. Maybe you're in a season where it's summer and there's berries and it's easier to find animals to eat. And then you go into winter and, your body is designed to be able to feed off of different types of fuel substrates. So we can talk about whether it's stored glycogen, which gets stored in the muscle and liver, whether it is stored fatty acids. Our bodies are adapted to be able to use different types of fuel substrates. And this is what's important, because most Americans, like I'm going to emphasis on most Americans are in a position where they're eating too frequently and they're eating the wrong types of food. So they're never in a position to be able to tap into fuel stores, to tap into fat as a source of fuel. And that is the type of fuel that when you talk about comparatively with your husband, if you're utilizing stored fat as a fuel source, it's like putting a big log on a fire. It's designed to be long lasting, consistent amount of energy, as opposed to kindling, which burns off quickly. And that's when you have people that will say like their blood sugar drops and they get really angry. They get hangry. They struggle to lose body fat. They, struggle with energy issues. And unfortunately, that has become so common that we think it's normal. Like I remind people that when my kids were little, I have all boys, they couldn't go as long in between meals because their little bodies are like, they're like hummingbirds. But once they got to a point, now they're teenagers, they can eat 2 really big meals and then go many hours in between meals. And so I think that we need to educate individuals that our bodies are designed to not eat so frequently. And then this whole process, whether you have 12 hours of digestive rest, whether you have 16 hours fasted, all these things have benefits, but it's just like any strategy or any hormetic stressor. It's like right amount of stress at the right time. When you're going through a divorce and you've lost your job and you can't sleep, that is not the time to add gasoline to a fire. This is where I sometimes see well-meaning people, they're like, oh yeah, but I have to continue intermittent fasting. No. Your body is like screaming because there's so much stress. We become stress resilient as we're navigating perimenopause into menopause. And so what you could get away with in your 20s, like when we would get away with staying up all night and drinking, and then we'd sleep 2 hours and we'd go take an exam and then we'd do, rinse and repeat. We can't do that at this stage of life. And that's not necessarily a bad thing. It's helping us understand there's a right time and a right place. And for a lot of women, again, it goes back to that self-flagellation. It's like, have a little bit of fasting is good, more is better. If, more exercise is good, then I don't want to take a rest day. I'm sure that you see this in your community. Like I have women that want to do Orange Theory Fitness or CrossFit like 6 days a week with no rest days. And I'm like, you are setting yourself up for a problem. And
that's no good.
No, I'm like, I don't want to do that kind of intense exercise every day, all day. Like, no, thank you. I like to exercise, but I think that we have to be kinder to our bodies as we are navigating this transitional period.
Well, it's a more, honestly, I hate this word because my whole platform is about resilience, but it is a more fragile time. It just is. Unfortunately, our stress levels are through the roof in middle age. Our anxiety starts to go crazy as our estrogen wanes and our poor brain freaks out, and it's so different for each person. I did not appreciate this as much as I should have. Of course, we never appreciate anything until we're going through it, right? We can't, when you're in your 30s treating, I was slinging hormones in my 30s, treating menopausal women. I didn't listen to the Women's Health Initiative. I knew it was a busted study. I was using topical, transdermal estradiol and progesterone. We were fine. But, you think, and I would just sit there and be like, these poor middle-aged women would come in and say, I don't know where this 15 pounds came from. I haven't changed anything. Now I'm working harder. Now they're like CrossFitting and orange theorying themselves to death. And then they're, intolerant to alcohol, particularly red wine. And I'm just over there taking chart notes thinking, oh, that sucks for you, And then I found myself in it years later and I was like, oh, this sucks. But how my brain reacts to lack of estrogen is entirely different than how your brain might react to lack of estrogen. And so those women, it really pisses me off when I see women online, especially influencers with big audiences, say you don't need hormones. You're just like, there's this one gal who's like a vagina expert, and she's like, you just need to be more well fucked. And I'm like, honey, I am. I am. I have a hot husband and we have a great sex life. But like, that is such a short-sighted, horrible, this is what we were talking about, how women hate on other women.
Yes.
It's a terrible way to be, because me without the right amount of estrogen in my brain is a crazy person. I don't get hot flashes. I get morbidly depressed and start thinking of ways to end it. That is what lack of estrogen does in my brain. And I get terrible flat affect of just not giving a fuck. And it's not good. I'm talking I'll just take my dogs and drive away from my family and never talk to them again. And I don't care. That's what lack of estrogen did to me. So I think it's very individualized how each of us is going to respond. And that includes our fat deposition, that includes our metabolic health. And something I never hear influencers talk about that I know you appreciate is, how did we get here? Because what you just described in your 20s, how hard we rode that line in our 20s and how abusive we were to our body. I was extremely abusive to my body. I didn't sleep. I ate garbage food. I chain smoked. I drank like a fish. I just did not, and I had massive amounts of stress and really high expectations, and was taking, I was doing really difficult and challenging degrees in college and just burning the candle at all ends for so long. And then a single mom building a practice for so long. And, just all of it, that when you get to 50, all of a sudden all that stuff adds up and comes back to bite you in the bud. And it's like, to see these influencers, especially the men online, being like, you should intermittent fast for 16 to 18 hours and you don't need hormones, you just need to work harder. And I'm like, dude, what about the 5 decades of my life that got me here? Yeah. Those all add up and they all still count. Yes. There's still repercussions of all of that. And so here we are sitting in this time period where I just think and that's why I go back to this fragile term. It's like, we have to give ourselves some grace and compassion and stop listening to all the freaking influencers online and use common sense. And you're one of the few people I see actually bringing this more nuanced common sense to the platform, because man, even some of our colleagues, people that we call friends, have these really polarizing ideas and this is the end all be all solution. And I'll blame the carnivore community to some degree for this one. It's like, dude, I know you're smarter than that. What gives? What are you trying to sell here?
Well, I agree with you because, for me, we know that women experience over 100 different symptoms in perimenopause and menopause, over 100. And it is as bio-individual and unique as each one of us are. I tell people, had I not gotten sick in 2019, I very likely would not have gone into menopause as early as I did, but I lost 15 pounds. I was in the hospital for 13 days and I almost died. And so that was how I got shoved off the cliff. And so I like to tell people I didn't have a ton. I remember I had a couple, when I say hot flashes, I remember I was doing laundry one day. This is before I was hospitalized. And I was like, what was that? It just stopped me in my tracks. I was like, what was that? I texted my cousin who's a GYN. And she's like, congratulations. You've been indoctrinated. And I would get them so sporadically that it wasn't a really serious symptom. I didn't have a ton of symptoms at the tail end of perimenopause and menopause, but that is not necessarily the norm. That was what was the norm for me. And the thing that upsets me about the vagina piece, because I think it needs to be stated, there's something called, it's a horrible name, genitourinary symptoms of menopause. It's not a question of if, but when. Mm-hmm. By the age of 60, it's 70% of us will have painful sex, friable skin. What a lot of people don't understand is that the withdrawal of estrogen from that particular body part changes the pH level of the vagina, impacts the microbiome of the vagina, the lactobacilli that create mucus that allow us to have, this lack of friability and good, good ability to
Elasticity and
moisturize
turgor.
things, elasticity, turgor. I mean, it is both estrogen and testosterone that impact this. And so when people say, oh, just shut up and use coconut oil and lube, I'm like,
oh my God.
Evidently, you don't have a vagina, because if you did, you would never say that to another woman. So the one thing I've learned is that me personally, and then all the thousands and thousands of women I talk to, most women by the age of 60 are using some type of either vaginal estrogen, vaginal DHEA, because we know DHEA and testosterone impact that muscular layer of the vagina. So it's not just about, adjusting the pH. It is multi-cell layered, muscular layer, epithelial layer, helping women understand, like, you don't have to suffer.
Right.
Number one, like, if I had a dry vagina, I would be very unhappy. Like, it would be very uncomfortable. I mean, think about it. If you've ever had a urinary tract infection, a yeast infection, an STI, anything, any of the above, when something doesn't feel right in that area of your body, it is all consuming.
And what people don't understand is that as women age and this process goes on, what I have seen clinically in my practice is that some of these gals, because I had patients that were my mentor's patients, so they were in their 80s. I was taking care of, and in their 90s even. I had a whole,
That's awesome.
I had a whole group of these great older folks that had been with my mentor and then me. I mean, for this is decades long, and something happens when you start to lose feeling in your vagina when this happens.
Yes.
And I think that you start to lose probably nerve connections, and at least nerve connections and vascularity.
Clitoral atrophy. So
going, so like the distal, proximal for the listeners means center of body, distal. We start to lose the distal connections of these nerves and vasculature. So that's a problem, right? But as you start to lose feeling, what happens is these women get really severe urinary tract infections into kidney infections, and they don't even know it. They don't even have that. You and I, as young women getting UTIs was like, holy God, I'm dying. This is so painful. Even now when I get a UTI, it's like, I am in so much pain. I can't, they're really intense for me. These women don't even feel it until it turns into a kidney infection. And then they show up in my office or your ER and they're septic.
And they can die from a urinary tract infection.
Yes. And they get, like you said, they get cognition issues and then they fall down. I mean, that's what you were just talking about. So for people to understand that in like regular terms. Yeah,
it's interesting.
Is terrible.
There's a urologist online who talks about the economics of vaginal estrogen. That if every woman in the perimenopause to menopause transition, some people don't need it right away, but most of us will eventually need it. The economic impact of using vaginal estrogen is so enormous. It could prevent millions and millions of hospitalizations, not to mention the fact how many women of my patients when I was in cardiology were taking chronic low-dose antibiotic therapy because they had chronic UTIs. And they would tell me, I would say, why are you taking Bactrim? Why are you taking amoxicillin? And they would tell me, if I miss it one day, my urine smells really bad. Like they knew enough to know that that was a sign they were starting to get a UTI. And I thought to myself, oh my God, how many of these women, all they needed was vaginal estrogen, which is dirt cheap.
And over the counter.
Correct. It's
over the counter.
And if you are a woman that is 10 years in a menopause, 20 years in a menopause, everyone, including, again, you have to check with your specialist, but the research certainly suggests, even if you are treated for breast cancer, you can take vaginal estrogen. That is such an important point because it is not systemically absorbed, it's locally absorbed. And I think that it is so important to have these conversations because I still think there are women out there, like I have a woman on my team who talks very openly. She's a breast cancer survivor. She's 5 years out. And every time I would read a paper, I would send it to her. And I was like, you need to be on vaginal estrogen. There's no contraindication. Full stop. We just have to find you a provider who is not knee-jerk paranoid to prescribe you a drug that is not systemically absorbed. And oh, by the way, there's a book called Why Estrogen Matters written by an oncologist and a researcher. Avram Bluming is like, if men had to put up with the poor care that women have received they would never have tolerated it. And when I interviewed him, I got chills, and I felt like for the rest of my existence, it's like helping women understand that it is your right as a middle-aged woman to be able to have access to therapies that will allow you to have a high quality of life.
And estriol cream is available over the counter.
You can put it on, and you can put estriol on your
so
face.
Is progesterone,
too.
You know? I mean, not the well, shoot, I found micronized progesterone on Amazon the other day. Like,
no.
Yes.
That's amazing.
This is testament to how non-dangerous these things are. For all the fuckery that the FDA gets up to. It is. The nonsense that sometimes I see happen with certain organizations when they're like, oh, we're going to take this off the market. Just one fell swoop, and like we lose methylcobalamin maybe. That I remember when that was the big argument. Well, estriol was on the chopping block too, and yet estriol still remains available over the counter. So I'm just saying, like, obviously check with your provider and obviously make sure it's right for you. And we are not your doctor and we are not providing medical advice here, but this is just such a no-brainer. And I was taught I had two big mentors. One of them was a hormone expert, and that's why I never stopped prescribing hormones. And she always said, just like men, the vagina and the rest of the body are two separate things. So just like we've always known that like men have two brains, if you will, our vagina is completely separate when it comes to applying these things. And yes, absolutely. DHEA topically is available over the counter.
And it's amazing.
Yes. And it hurts my soul when I get messages from followers. I had this nice lady message me, and she said that her husband had died 5 years earlier, and she was all alone, and she was an older gal, and she was having a lot of UTIs, and she was just miserable. And she said it was fine when her husband was around, probably because, it's a use it or lose it area too.
Correct.
So she wasn't using it. And I said, well, please go talk to your doctor about estriol topically. I'm not giving you medical advice, but this is like pretty well known in my community, and maybe your doctor is familiar with it. She went to her doctor and talked to them about it, and they prescribed it. And she wrote me back and said, this is just night and day. Like, my chronic UTIs are gone.
It's amazing.
I don't know how many prescriptions I've written for that. And I smear it all over my face, So,
yeah, no, it's multi-purpose. It's totally multi-purpose.
Yes. And I'm so angry that we're in 2025 and you and I are sitting here talking about this and people still don't get it. And they're still scared of estrogen, and they still haven't read Estrogen Matters, and they still haven't seen Avram Blooming's work. And he's published so many papers, and he's been on so many. I keep trying to get him on my podcast. Maybe you can hook me up with him. I just think that this is just such an untold story, and a whole 2 generations of women have been completely screwed over because of it.
Well, and it's interesting because I think about my mom's generation. And so my mom has 3 sisters, and my dad had 1 sister. So all my aunts have kind of given me permission to kind of talk around what they've experienced. But, for me, like watching my mom go from being on HRT and she never had any joint problems to suddenly being debilitated with osteoarthritic symptoms, which wasn't osteoarthritis. It was this loss of estrogen.
Yep.
So painful. They put her on COX-2 inhibitors, which ironically enough got pulled off the market. She was on Vioxx.
Wow.
She had so much pain in her feet and her hands that she could barely function. And she was like, I know enough not to take anti-inflammatories habitually, but she's like, I have to be able to function. She was at University of Pennsylvania. And, for me, it's like looking at the neurocognitive decline that I see in loved ones, which I find so troubling because I know for myself, I tell my husband and my boys, I'm like, I never want to be a burden. I think every person out there doesn't want to be a burden to their family. But I'm like, it's one thing if I like suddenly like break a bone. It's totally different if suddenly I am on that neurocognitive decline and I'm at risk. Like my stepmother had end-stage Alzheimer's, and the entire unit that she was in, which was a very small, lovely unit, 95% of them were women.
Can you imagine if we could give all those women B12, thyroid, and estrogen?
They would have not been there. Like my stepmother would look at me and she would say, I know something's not right with my brain. It was one of the saddest. It was like this total regression in her memory, and they would keep adjusting her medicines. And I'm like, you realize now the research actually supports what you're giving her. It just makes you feel better to put her on something when what her brain needed all those years was estrogen.
It's enraging and heartbreaking. And I didn't even have that low of a level, and I was having that kind of pain. And I was using topical estrogen cream, and it just wasn't, I was being kind of mamsy-pamsy about where and when and timing of it. And that all matters. And I finally just slapped a patch on just to see what would happen. All the pain went away, like bone splitting spinal pain that I can't even describe, to the point where I was telling my husband, like, if this is how bad it is right now, how am I going to deal with this when I'm 80? Like, how am I going to survive this? And just shifting from the topical, I'm still menstruating normally. I am in allopathic medicine. I would not be a candidate for any of this, but you and I know better, right? We supplement the physiologic dosing that needs to happen. And I couldn't believe just getting steady state estrogen. So, I mean, that's even another layer of the complexity of this, is like having a practitioner because I know practitioners who are not willing to go outside of the creams. And
not everyone absorbs them. So let's be clear, like not everyone absorbs. So I take oral compounded progesterone because I need the sustained effects. I have an estrogen patch. It is the greatest thing known to man. Yes. I had compounded estrogen, but I just wasn't absorbing it. But now it's so nice. It's like twice a week, Monday and Friday. I take my patch off. I put a new patch on. And for me, what was interesting was when I would say to people, I don't really get a lot of symptoms, I feel much more mentally sharp. I don't think I even realized until we did labs, and I looked at my labs and was like, I have like an imperceptible amount of estrogen on board. We need to do something else. And then I use compounded testosterone. But for me, the difference for a patch versus compounded for me personally was so significant, because as a podcast host, you understand this, as someone who's online, it's like, you don't want to be thinking like struggling with words, like word finding, that's scary. And so I definitely, like, retrospectively, I'm like, holy cow, it's like a little light bulb got turned back on brighter in my brain. I was like, oh, this is a good thing. So I think the point I'm trying to make, and I think both of us are making, is that everyone needs a little bit different. Working with someone that is willing to take the time to do a little bit of experimentation. Because for me, I think I was so fixated on, oh my God, there's something wrong with taking a patch. No, it's cheap. Like, I think I just paid $15 for 3 months of patches. And I was paying, I don't know, $100 a month for a tube of estrogen that was compounded. It wasn't working for me. And if it works for you, that's great. It wasn't working for me. But having said that, if you can take oral micronized, immediate release progesterone that's covered by insurance and is dirt cheap, check box. Same thing with those estrogen patches. Works for you, check box. I think that's awesome. I think that each one of us might need something slightly different. But I can tell you that, like, world of difference on an estrogen patch. I'm like, raw estrogen patches. It's super convenient.
And for those listening who, whenever, I talk about this stuff, I get bombarded with messages from women saying, how do I find a good doctor? My doctor won't do that. Find a new doctor. You have to I have a whole free video on my website called How to Find a Good Doc. And it's right there in the menu. You have to do some legwork, and you have to find someone. The more we talk about this, the more that we share out, the book. We've got a whole army of women now talking about this, female doctors. We've got Dr. Mary Claire and her best-selling book. We've got your book coming out. We've got a lot of people talking about this. My goal in 2025 is that I expect all doctors to do better. I want all of the people listening who are patients to go in and demand that their doctors do better. And if it doesn't work, go find a new doctor. And you probably will have to pay out of pocket, and that is okay. It is the best money you'll spend. So us educating people, and those people actually, like, it's an army. It's a group effort. We have to get because these doctors have to go learn this stuff. The reason doctors don't want to do this stuff is because they don't want to run the labs, because if whatever they find on the lab, they're responsible for managing, and they don't know how to manage a lot of these conditions, or they don't want to get into it. And that's okay. Maybe that's not how their practice is set up. You can't expect a general practitioner who's only getting paid to see patients for 5 minutes to really be able to handle this stuff. You have to go find somebody who this is what they do all day, right? So to the patients listening, like, just understand how the system works, and go find some people that you can work with who are savvy to this and who are willing to help you. And ask your girlfriends. Go find your hottest,
Absolutely.
go find your hottest middle-aged girlfriend. And trust me, she's hooked up.
She's taking HRT. Trust me. Trust me.
Yes. Go find your hottest 50-year-old girlfriend and be like, who are you seeing?
Yeah.
and go see them and spend the money and get it handled, because it's life-changing to have your brain come back. What I don't want to see is, my daughter's 24. I don't want to have dementia by the time my grandchildren are born. I don't want to be that grandma that's frail and not strong. Like, I want to be the hot, cool grandma that takes them on great vacations, looks good in a bikini, and has fun and has really sharp as a tack cognition until I'm old and I'm teaching them how to strength train in the garage. Like, I just have a different version of what getting old is going to look like. And that's not possible without hormones, in my opinion.
Yeah. Well, it's interesting. I went to an event I spoke at in November, and I was leaving with two of our friends, and I was in between them, and my sandal got caught on a tree root. And so I fell forward, but I didn't realize I was falling. I fell on my chin and my elbow. And so I'm in between two physicians, and they're like, oh my God. And I was like, I'm fine. Because I was so embarrassed. And I remember I had this huge hematoma on my chin. I didn't break anything. I didn't fracture my elbow, thank God. And I went to see the orthopedic surgeon the next day, because I was like, I had a really bad sprain. I didn't break anything. And she was like, God, you're so lucky. And I said, no, I'm telling you, I do all the things, because first of all, I didn't realize I was coming down, and it was not I don't drink alcohol. It wasn't because I was drinking. I just got my shoe caught. But I remember thinking, like, oh my God, if I were any other person, I would have probably would have knocked out my teeth, probably would have fractured my wrist. And so I think all the time, preventatively, like, I want to be, in fact, my trainer has me on and off the floor constantly. And she was saying to me, like, a lot of her clients complain about this. And I said to her, well, I know you're doing it for functional reasons. And she said, absolutely. Like, she said, it is so important that you can get up and down throughout a workout, because that is mimicking real life, as opposed to, just going from like one weight machine to another. She was like, I've learned and she's in her 60s, she's a kinesiologist. And she said, I've just learned that the people that navigate the aging process the best are the people that are more agile, more flexible. And so those are things that we work on. But the reason why I wanted to interject that was, I think for every person listening who doesn't have that ideal person that they're working with, I can just very transparently tell you, I have a wonderful GYN. She's young. She's just out of training. You know what she told me? She loves taking care of middle-aged women. You know why? Because for most of us, we are done with birth control. We are done with the concern over pregnancy. She's like, you guys are very clear about what you want. You're very clear about like what kind of care you want. And she's like, I'm happy to write for hormone replacement therapy. I am happy to talk about vaginal estrogen for my breast cancer patients, because it's a quality of life thing. You go over risk benefits. And she's so pragmatic and yet so young and wise. And I'm like, I'm hoping that this generation that's coming up is going to be more like that, as opposed to like, oh my God, you're going to just use your lube and your coconut oil and you don't need any vaginal estrogen. Yes, you do. We all need a little, maybe not in your 50s, maybe you don't need it till you're 60, but to be thinking ahead. The other thing that I would add is I have a wonderful family member who fractured her hip 2 years ago. At the same time my dad was hospitalized this past May, she fell, fractured her femur. So the long bone in the leg, same side. This person has not been able to walk since May. And it is so, and she is sharp as a tack mentally. It is so hard to watch your loved ones, your family members, your friends navigating the aging process without fully understanding, like, that is what we want to try to avoid, because it is so catastrophic. Not being able to walk is a catastrophic issue. And, it's horrible. It's terrible, because the less she exercises and moves, the more frail she becomes. And so I've had to have these conversations with these family members just to say, it's not my place to interject, but, make sure that you're just aware of what's going on here. But that doesn't have to be our destiny, is the point I'm making. I think with amplification of our voices, podcasts like this, it's helping women understand you can advocate for yourselves. And to understand that if you are not working with someone right now who's able to meet your needs, there are lots of other individuals. There's actually a lot of places now do telemedicine. So maybe you have an internist, and then you work with one of these telemedicine companies that have fully licensed PAs, NPs, physicians that can navigate your options and, do lab work and be able to make recommendations because, it's like a wild zone out there, but it doesn't have to be. I'm so grateful that we're 20 years out of the WHI and, things are starting to come full circle, but there's still a lot of misinformation. In fact, every once in a while, someone will come on the podcast and they'll say something that's actually inaccurate. And then my people pick up on it. And then I have to then explain it. Like, I cannot filter every single thing someone says as a guest.
Right.
And I said, everyone is well-meaning. That's why that's the vetting process. But having said that, everyone deserves to have good care. Everyone deserves to still have a libido, feel vibrant, healthy, cognitively intact. I think both you and I are 100% in agreement about how important that is, not wanting to be a burden to our families as we get older. And certainly these are the things that I think really make a big impact.
100%. I want to just be juicy and bouncy. Like when you fall,
bouncy.
Yeah, when you fall, you should bounce. You shouldn't
That's
shatter.
What happened to me in November.
Yeah. I had a big fall a few years ago, and had I not been as strong as I was and able to catch, I literally fell face first into a giant curb. Yeah. And I caught myself. I remember looking up at my boyfriend at the time, and his face was like, because I was going down, and I turned my head to miss it, and I caught myself and I pushed out of it. And I had actually been complaining to my coach because I was starting to get some pretty big shoulders at the time because my hip was injured. And so we were really focusing on bench press. And
that's your advantage.
I was doing a lot of benching and push-ups because I could only, I had to do something. So I was working my upper body, and I caught myself and pushed out of it, and I stood up, and I definitely got a huge hematoma on my leg because I hit the other side of the curb. Like it was a whole thing. But I got up and I looked around, and I immediately, because we just come out of a concert that was like very age appropriate, it was like an older band. So everybody there was my age, and it was like a big middle-aged crowd. And I looked straight at him, and I was like, if that was any other woman in that arena, like they would be missing teeth and be in the ER right now.
Yeah.
And I kid you not, my best friend from high school, who has not gone down the healthy pathway. Like I said, we used to drink and smoke like fishes, and she walked by right then. And it was like, the timing of that, she walked by and she didn't walk the same path I did, but close. And I thought if that had been her, that would have been just an absolute debacle.
Yeah. Yeah. It makes you very humble to realize as we get older, we have to, like, that agility, like it becomes a running joke. My husband always says he has cat-like reflexes because he played college lacrosse and still played up until the pandemic, and now does a bunch of martial arts, but he'll talk about his cat-like reflexes. And so sometimes now I wink at him like,
we're probably doing a lot better than most of the folks our age, right?
Totally.
That's the goal.
Well, I think what's interesting is you go to events, whether it's an event we're just enjoying or an event where you're doing like continuing medical education, and you start to realize that we're doing far better than we realize if we like look at ourselves as an example of people in this age range.
Yeah.
And everyone that's listening has the ability to course correct. It's not a, it's you set yourself on one course, and that is going to happen irrespective of what lifestyle choices you make. It's helping people understand you could always course correct. There's always things you can do to improve, not just your metabolic health, but changes in body composition. Because the one thing that a lot of people don't talk about is when your body is changing, and it is inevitably going to change as you're navigating this middle age piece, there's a lot that you can do proactively. You don't have to just sit back and feel like you're a passive conduit.
Absolutely. So on that note, what are your thoughts? Because we've just got a few minutes left. I want to be considerate of your time. How does this tie into going back to the conversation about intermittent fasting? So we kind of went on a good detour, but like going back to that piece of, I think we're a little more sensitive when we hit middle age. So I guess
Absolutely.
fragile is the wrong word.
Yes.
Sensitive. And I think that intermittent fasting for a 30-some-year-old woman versus a 50-some-year-old woman, can you talk about that?
Yeah, absolutely. So I'd be the first person to say, if you're a 30-year-old female who's training, who's very lean and very athletic, I'm not sure I really like the concept of intermittent fasting because your body is exquisitely sensitive to nutrient intake, number one. Even if you are choosing not to get pregnant at that point in time, your body is so exquisitely attuned to nutrition and timing of food. And depending on where you are in your cycle, like as an example, in the follicular phase when estrogen predominates, you can probably get away with a harder workout You could probably get away with a degree of carbohydrate restriction. You could probably get away with a little bit of intermittent fasting. But if you're trying to build muscle, probably something you have to be very conscientious about. Now, if you are a 30-year-old who is obese, not metabolically healthy, maybe a PCOS, a little bit of fasting may actually be beneficial for you in that follicular phase. And to help people understand, estrogen is this incredible insulin sensitizing hormone. So that's that kind of first half of the menstrual cycle. Then you transition after ovulation to luteal phase. This is when progesterone predominates. This is what I generally encourage women to take a break.
Yeah.
This is 12 hours of digestive rest. This is maybe you're more interested in doing yoga, stretching, flexibility classes, probably being conscientious about what you're consuming, but you may need to liberalize some of your carbohydrate intake. I'm not talking about like brownies and ice cream. I'm talking about maybe you have a little bit more sweet potato. Maybe you have some low glycemic berries. So intermittent fasting for women that are still menstruating is always highly dependent on your menstrual cycle. Now, as women are navigating perimenopause and menopause, so we're really talking about late 30s, early 40s, we become a little less stress resilient. So our ovaries are producing less progesterone. And sometimes this shows up for women. They have issues with sleeping. They may have more anxiety or depression. Again, as you and I have both spoken to, every woman's a little bit different. So some women have wild fluctuations in mood, wild fluctuations in their sleep quality. And I remind women that, again, the same things apply. Where you are in your menstrual cycle matters, but this is when you become less stress resilient. So if you are going through a divorce, you lost your job, you've got a big move, a family member gets sick, adding intermittent fasting or extreme fasting, like you're doing 3 days of fasting, 5 days of fasting, 7 days of fasting, is adding gasoline to a fire.
Yes.
And so I think that when I speak to women, I help them understand like luteal phase, irrespective of age, 12 to 13 hours of digestive rest is completely appropriate. If you are a woman in perimenopause, you're sleeping well, your stress is dialed in, you eat an anti-inflammatory diet, you're doing the right types of exercise, you probably can get away with a bit of intermittent fasting, but this is not chronic caloric deficit. I think this is a really important point to make because what do I see? I see women that are in perimenopause, they become weight loss resistant, and they think if a little bit of fasting is good, more is better. If a little bit of, caloric restriction is good, more is better. And so they whittle themselves down into OMAD, which is 1 meal a day. I take a ton of heat when I say this, but I'm like, OMAD is not a sustainable strategy. I don't care who you are. I know I'm going to get hate for this, but
I think it's
not
bonkers.
Nourishing your body. we have a free group on Facebook and we've had to whittle some of these people out that are zealots. They're like, it worked for me. I lost 50 pounds. That's great. But you cannot live in a caloric deficit for the rest of your life. At some point, you have got to eat some food, like good quality food. So helping women understand that when you're talking about intermittent fasting, it is not 1 meal a day. It is making sure you get enough protein. It is helping women understand we need more protein as we get older, not less. So what my teenagers can get away with 10 milligrams of 10 milligrams of protein, and they sneeze and they trigger muscle protein synthesis. I need 40 or 50 grams because we just need more to actually trigger that muscle protein synthesis. And so when I go back to women in perimenopause and menopause, the same thing applies. You may not in menopause have that menstrual cycle, but you are still less stress resilient. You have to be conscientious of what's going on in your personal life. If you're not sleeping through the night, fix that first. If you're having horrific hot flashes and you crave carbohydrates like it's your job, fix that first. 12 hours of digestive rest, anyone can do. My teenagers can even do that. But intermittent fasting is always the context, right strategy, right time, not over fasting, not undernourishing your body, because that's the nuance that I get concerned about, is that I start to understand that far too many people have gotten the message that more is better, that we we self-flagellate, we punish ourselves. And remember that strong over skinny, like when we have, the little alligator eats the strong and not the skinny, it's like helping women understand that the message is never to undernourish your body. The message is to get reacquainted with what true intrinsic hunger feels like, to get reacquainted to how does your body feel when you slept really well through the night and you decide, okay, I'm going to fast twice this week. So on Tuesday and Thursday, I'm going to get up. I'm not going to go to the gym and do this horrific workout and then self-flagellate till 2:00 in the afternoon and eat. So it's like really about being aware to how your body feels. And for some people, it takes time. I don't expect everyone listening that's gotten so out of touch with how their body feels when it's truly hungry or when they feel like they're ready to receive food. That's not the point I'm trying to make. What I am trying to make the point about is we want to be in a position where we are nourishing, not over fasting, making sure that we are doing what's right for our body at that time and space. And for everyone listening as well, I have gotten away from doing a lot of intermittent fasting. I still intermittent fast episodically, but I've really worked very diligently to consume 3 protein boluses a day so that I can build muscle. And that has superseded my desire to do these long fasts. So like, again, we talk about fasting as a practice. You can change your mind. You can be flexible. You can course correct.
Yes. I love it. All of it. I completely agree. I've had to go, I've had to move away from some of the longer fasting windows as I've gotten older as well. And really it just comes down to turning your instincts back on. And it's kind of a vicious cycle though, because your stress levels will supersede your instincts and screw with your blood sugar. And then you start to become insulin resistant. And then you become insulin resistant because your estrogen's low anyway. And so it starts to become this sort of downward spiral. This is honestly where I think personalized, very small doses of GLP-1s can be miraculous to not only help heal that metabolic health, but and slow the roll on that whole thing, but give people a little bit of onus of control back. So it's, more of an appetite control, not appetite suppression. I'm never dosing
the noise
into
in the brain.
Yeah, I'm never dosing into appetite suppression. I was talking to Dr. Amy Horniman yesterday, and we were like, neither of us are like not hungry. Like we're still very hungry, But I think that that's a tool, but you can't do that without getting the HRT on board too. You have to. This just kind of summarizes, it's a tool. The intermittent fasting is but one tool in the toolbox of this comprehensive way that you and I and the guests I have are talking about. It's like you have to do all the things, and these extreme windows of fasting, especially as you are navigating perimenopause and menopause, is just not always working in your favor. We don't want to add stress, like you said. We don't want to add fuel to the fire. We're trying to quell stress. And if sometimes for me, that is a carbohydrate bolus, that is a big bowl of rice with some chicken on top or whatever. And I know what I'm doing though. I don't eat that all the time. Right. But sometimes if I need to calm my nervous system down, I know how to use food strategically. And that only works if your instincts are on and you're not trying to follow some fad diet or go all carnivore or all keto all the time. These are intermittent tools. And so I really appreciate your take on this because I think it's nuanced, right?
It is very nuanced. And I think for a lot of people, something has worked well for them, whether it's low carb, keto, carnivore, and they become rigidly dogmatic about it. And I think that throughout the past 10 years, I did 9 months of carnivore after being in the hospital because my gut was wrecked from antibiotics. And then I was like, I miss vegetables. And I've done low carb cyclically, but the one thing I can tell you is, along with this 3 meals a day thing for me, adjusting my carbohydrate intake based on my physical activity has been life-changing. I think I got whittled down to, I'm like low carb-ish. And I started to realize like, it's okay if I have a little bit more sweet potato. It's okay if I eat more vegetables. It's okay if I have a little bit more fruit. And fruit for me is not a food, like a forbidden food, although plantains, which is so sad. I love plantains. They don't like me. It's like the one thing I figured out. Doesn't matter what I eat beforehand. It does the same thing to my blood sugar. So I have to just accept that. But the point of what I'm saying is we should not become rigidly dogmatic, whether that's fasting or a nutritional philosophy that we believe in. I think that what we want to aim to do is less ultra processed food, eating more nutrient dense foods, and being more conscientious about protein intake, because we all know, one thing about protein is that it's satiating and it's going to help buffer some of the catabolic effects of navigating perimenopause and menopause. And that's important. So catabolic means we're breaking down muscle. That's the other thing about long fasts. You are breaking down muscle. And that is something we want to avoid doing.
And you're breaking down your gut lining, especially if you're a chronic faster chronic super low carb, you start to really lose that nice mucin layer, which is pretty important to your immune system.
Yeah, one cell layer thick.
Yeah. So there's a lot to this. It's not as simple as your favorite influencer and their dogmatic ways are telling you. And also, ladies in middle age, can I just say this? Can we stop? I'm not trying to throw all the men under the bus, but I am so done with hearing young male chiropractors tell us how bad HRT is and that just do my way of these extreme diets and take my supplements. And I'm like, oh, shut up.
Yeah.
Shut up.
there is an influencer out there that shamed one of my patients into taking HRT. And she was at the point where it was impacting her mood so significantly. I could see it. And so when she finally went on hormone replacement therapy, she was like a different person. And she said, that person, who is a male, that person shamed me into thinking I didn't need thyroid replacement, that I didn't need hormone replacement therapy. And she said, I'm so glad I didn't listen.
Yeah, get rid of those guys. I'm sick of them. I'm in 2025. I just did a whole podcast episode about it. I'm not listening. We're not listening to those guys anymore.
Well, it's just the whole shaming thing. Like, it's one thing if no one's telling you to take poison, but that's the only instance in which I could imagine someone could justifiably say, let's let you suffer because your thyroid is in the toilet. And we've ruled out every other reason why this could be ongoing and just let you suffer and have your hair falling out, you're exhausted, you can't sleep, you're miserable. Like, that to me is silly. And
they have
pointless.
A supplement for you though, Cynthia. They're going to sell you their supplement and their protocol. That's how they work it, right?
No.
Yeah.
This one person's on my naughty list, and I, like my team, I've already said, if this person asked to be on the podcast, it's an immediate no.
Blacklisted.
Correct.
I love it. Well, it's always so insightful to talk with you. I had so much fun on your podcast too. I feel like, of all, truly, I'm not saying this just to like blow steam up your bum. Of all the people I talk to, I feel like you and I really have a lot of similar thoughts around all of this. And I appreciate you for that. And I appreciate that you're out there with your audience and your podcast making noise too, because more women, I just really want more women to get this message.
Yeah, amplify. That's really what it all comes down to, is just helping women get educated, inspired, and empowered to advocate for themselves. Yeah, the days of women going quietly into the night are gone.
Yes, amen. Well, where can everyone find you?
Easiest place to go is my main website. So it's www.cynthiathurlow.com. Dr. Tina's been a guest on the podcast. Everyday Wellness is one of my favorite things I do in my business. I'm pretty active on Instagram. I'm a little snarky on Twitter. And I do have a free Facebook group called the Midlife Pause / my name. I do have a new book coming out in 2026. My first book is on women and fasting. And this book is going to be a little bit of a departure. I'm getting back to my roots, talking about perimenopause, menopause, and the gut microbiome, which impacts everything, including bone health, immune function. That's why when people tell us not to think about hormone replacement therapy, it makes me a little crazy. Because I'm like, I don't think you understand the ramifications of the loss of sex hormones. So yeah, if you reach out, if you listen or watch this podcast, please let me know and send us a DM.
Awesome. I'll make sure everything's in the show notes. And I just adore you. When your book is out, come back on the show and let me help you promote it, because I think this is desperately needed information from a level-headed woman such as yourself. So
thank you.
Yeah.
Thank you.
Thanks for coming on the show today.
Absolutely.
Thanks for listening to the Dr. Tina Show. This is a Wellness Loud production produced by Drake Peterson and mixed by Mike Fry. Theme song is by John the Guilt. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtyna.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtyna.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.